We chose to do our topic on how healthcare prices have become a problem because they have gotten so expensive, and it's causing people to get more sick due to the fact that they cannot pay the medical bills. With the rising cost of healthcare, people aren't getting the care and medicine they need to survive because of the price. It is controversial due to the impact of affordability, access to care, our overall economy, and arguments people have on ways to fix this issue. The first law that was implemented in 1965 was the Medicare and Medicaid Act, implemented by Lyndon B. Johnson, established two landmark social programs providing health insurance for the elderly and low-income individuals. The second act that was implemented on March 23, 2010, increased health insurance coverage for the uninsured and implements reforms to the health insurance market, and this was the Affordable Care Act.
The cost of healthcare can lead to people not getting the help they need. Rick Shea in 2024 said that the decline was at least in part because of people foregoing care due to COVID-19. The share of adults going without mental care because of the cost increase through 2022 and increase above pre-pandemic levels by early 2023. Also, high costs combined with high numbers of underinsured and uninsured means many people risk bankruptcy if they develop a serious illness. Prices vary widely, and it's nearly impossible to compare the quality or cost of your healthcare options, or even to know how big a bill to expect. And even when you ask a lot of questions ahead of time and stick with recommended doctors in your health insurance network, you may still wind up getting a surprise bill. That's from Schmerling 2021.
Our second argument is, since the cost of healthcare is so expensive, people could not get their prescription drug refilled. Collins in 2023 said nearly 3 in 10 people in employer plans, more than 1/3 in marketplace or individual market plans, and about 2 of 5 people with Medicaid or Medicare said that they or a family member had delayed or skipped needed healthcare or prescription drugs in the last 12 months because they could not afford it. American prescription drugs spending totaled $378 billion in 2021, accounting for nearly 9% of healthcare spending and more than 1.6% of the United States gross domestic product. With such high prices, it's no surprise that 1 out of every 3 U.S. adults taking prescription drugs say that they've been unable to take their medication as prescribed due to cost, according to a 2023 poll from KFF Hughes 2023.
Our third argument is to get insurance for healthcare to lower the costs. We need to increase research funding for projects that will help determine which diagnostic tests and procedures actually benefit specific patients. This research will increase the number of evidence-based practice guidelines. Medicare should not pay for the procedures that do not benefit patients, said Dallin in 2010. Health insurance usually covers all or part of the cost of treating the disease or injury, said the National Library of Medicine in 2001. A health insurance plan includes a package of covered healthcare items and services and sets how much it will pay for those items and services. In other words, a health plan will describe the types of healthcare items and services it will cover, how much it will pay for those items and services, and for how long. Plans are often designed to last for a year at a time, said Healthcare Basics on page 1.
One opposing argument is that if prices for healthcare are lower, people are afraid that the quality of care they will receive will not be as good. The second argument is that people are also afraid that if the costs of healthcare get lowered, they will get delays in their treatment and have reduced access to treatment.
Our plan of action is to promote preventative care, increase transparency in pricing, encourage the use of generic drugs, and promote healthy lifestyles. You can improve costs by implementing bundle payments, reducing unnecessary tests and procedures, and promoting health savings accounts. You should contact your primary care physician, insurance companies, the pharmacy, financial assistance programs, community health centers, and nonprofit organizations.